Broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, this is Poe Tempah, and I would like to welcome you to today's presentation, which is part of a series of webinars provided by the Division of Public Health, Section of Chronic Disease Prevention and Health Promotion. The primary aspects of our work include health promotion, chronic disease and injury prevention, and data collection and surveillance. This webinar series was created to provide a way for us to talk about our projects and explore how we can work together. We will be offering webinars on the third Tuesday of every other month at 1 p.m. Another way you can stay connected to our work is through our newsletter. You can sign up for the newsletter on our section's website. Our website address is on this first slide of the presentation. There are a few housekeeping items to go over before we start. If you are listening by phone, please keep it on mute. And please do not put this call on hold. If you receive a call, please hang up and call back in. The webinar is planned for 30 minutes, a 20-minute presentation followed by 10 minutes for questions and answers. A recording of today's webinar will be sent to all participants and the slides will be made available online. Audio will be coming through your computer. You can also call the number provided. If you need help listening to or watching this webinar, please let us know by using the question function on the GoToWebinar control panel. To ask a question, you will need a microphone or you will need to call into the number provided. Please hold all questions related to the presentation until the end. Today, I will be presenting our section's webinar. Once again, my name is Poe Tempah, and I work with this section as a public health specialist. My area of focus is public health education and communication. I help oversee the public health education campaign called Play Every Day. The campaign is focused on preventing and reducing childhood obesity in Alaska. Today, I'm going to focus on how we worked with the Centers for Disease Control and Prevention and other partners to create a new series of public education materials focused on healthy drinks for healthy kids. The CDC Division of Oral Health has funded a 2-year project to increase collaboration between oral health and chronic disease prevention programs. Our section is working on this project with the section of Women's, Children's, and Family Health. We are calling this project the Healthy Drinks for Healthy Kids project. Our goal is to cut sugary drink consumption among children to improve oral health and prevent obesity and other chronic diseases. Our goal is to develop provider tools and public education materials to support reduced sugary drink consumption and to start a pilot project to work with dental providers to adapt and adopt a brief intervention focused on sugary drinks. Our section's Play Every Day campaign became involved in the Healthy Drinks for Healthy Kids project to help develop these education materials for dental providers and for public education. Play Every Day launched in 2012. From the beginning, it's been run through the Alaska Department of Health and Social Services. That said, the campaign has been able to expand its ability to reach Alaska families around the state by partnering with a number of organizations. I've mentioned the CDC. This year, we've been able to partner with the Alaska Dental Society and the American Dental Association. We are partners with the Alaska Native Tribal Health Consortium, as well as Healthy Futures, which is a nonprofit focused on providing free, low-cost physical activities for children. Play Every Day is a social marketing campaign focused on changing knowledge, attitudes, intentions, and health behaviors related to 2 key areas: getting kids closer to 60 minutes of physical activity every day and reducing children's consumption of sugary drinks. I'm going to spend a bit of time sharing what we know about obesity in Alaska. Obesity is costly to quality of life. Obesity increases the risk of weight-related diseases and increases the risk of type 2 diabetes and heart disease. Obesity is linked with more than a dozen types of cancer. Obesity is a significant concern in our state. In Alaska, 1 out of 3 children is overweight or obese, and 2 out of 3 adults are overweight or obese. Obesity is also costly in terms of dollars. In Alaska, about $459 million is spent every year on the direct medical care costs related to obesity. The CDC has set prevention targets for obesity. I've highlighted those targets being addressed through Play Every Day and our new Healthy Drinks for Healthy Kids project. Play Every Day is a public education campaign, so we are definitely working in the public communication setting. We're also partnering with dental providers for the first time. Right now, the key behavior change targets for Play Every Day are increasing physical activity and decreasing sugary drink consumption. What do we mean when we say sugary drinks? It's not just soda anymore. Sugary drinks include all of these kinds of drinks, including sweetened powdered mixes, energy and sports drinks, vitamin drinks, sweetened coffees and teas, and sweetened fruit-flavored drinks. We used to think that sugary drinks were harmful due to just their excess calories, but now we know that added sugar in sugary drinks increases risks of serious health conditions, including heart disease, type 2 diabetes, cavities and tooth decay, and unhealthy weight gain and obesity. Due to these increased health risks from added sugar, the U.S. Dietary Guidelines for Americans issued a limit on daily added sugar. The guidelines recommend less than 10% of the calories you consume come from added sugar each day. Let's look at the reference diet of 2,000 calories a day, which is what is found on the nutrition facts label on most packaged foods and drinks. For that diet, that means eating and drinking no more than about 12 teaspoons of sugar, 50 grams of sugar, or 200 calories of sugar each day. Where is all this added sugar coming from every day? When you look at how much sugar people are consuming every day, the number one source of that added sugar is sugary drinks. You can see this on the pie chart that almost half of the added sugar consumed every day comes from what people drink. I'm going to make that point again by showing you this data. What you see here is the U.S. population mean calories of daily added sugar. Adults are represented by the bar on the left, and children ages 2 to 18 are represented on the bar on the right. The lower dark blue portion of the bar represents the added sugar from drinks. The upper light blue portion of the bar represents the added sugar from food. While sugar is everywhere in cookies and crackers, breads, even pasta sauce, the single largest source is sugary drinks. Beverages alone account for about half of the added sugar calories in the diet. We've added this red dashed line to compare the current American diet to the guidelines based on the 2,000 calorie reference diet. Adults are almost reaching that daily limit of added sugar with just sugary drinks. Again, that is before accounting for any added sugar coming from foods. We know that many young children don't require 2,000 calories per day. Therefore, we've used the calorie estimate for a moderately active 8-year-old boy as shown by the solid red line. You can see here that kids reach the daily limit for added sugar from just sugary drinks alone. Again, we've drawn in the lines for the added sugar limits. The dashed line is based on the 2,000 calorie reference diet. The solid line is for the 8-year-old boy. This shows that even one sugary drink is too much. One sugary drink can take you over the daily added sugar limit or really close to that limit without even considering the sugar in foods we eat. If Americans and Alaskans could reduce or eliminate sugary drinks from their diets, most would meet the guidelines for less than 10% of calories coming from added sugar each day. Now that I've focused on the background of the health issue, I'm going to switch to one strategy we are using to address it. Play Every Day is a social marketing campaign. Social marketing uses commercial marketing techniques in the social arena. In the commercial world, you are selling a thing and your exchange is money. Let's say you want your audience to buy a car. You tell them how much it is, perhaps play up the great features it has. You might mark it on sale so it seems more attractive. In the social world, you are marketing a health behavior. You are asking your audience to exchange one health behavior for another. In our case at Play Every Day, we are addressing an audience of parents and children who are drinking sugary drinks, sometimes every day. Our campaign's message is to drink fewer sugary drinks and to choose water or milk instead. Like in commercial marketing, our job is to lower the price of that exchange, to make it more possible. Money or cost may be involved, but often it's other things. Maybe it's making water an easier choice for people or making it more available and accessible during the day. There are a number of possible audiences we could have targeted for childhood obesity prevention, but with limited resources, social marketing requires you to target an audience and create your messages with that audience in mind. Our target audience is Alaska parents of children ages 5 to 12. These parents are still choosing which foods and drinks are in the fridge and on the cupboards. Social marketing campaigns also have an end goal that goes beyond raising awareness of the health problem. It's changing knowledge, then changing behaviors. We have goals for changing knowledge, but I'm going to just touch on the 3 key behavior change goals here. We're working with parents to motivate children to get 60 minutes of physical activity a day, serve these children fewer sugary drinks, and serve water or low-fat milk instead. This presentation focuses on these last two goals related to drinks. Another key step for social marketing campaigns is using research tools to do two things: inform and guide the messages for the audience, and evaluate the messages to ensure they are reaching the audience and doing their job, changing knowledge, attitudes, intentions, and behaviors. To inform our messages, we use focus groups and key informant interviews. To evaluate our messages, we use telephone surveys. To support the public education efforts needed for the Healthy Drinks for Healthy Kids project, our section conducted a paper survey at 2 conferences for dentists and dental hygienists, 12 key informant interviews with various types of dental providers, and focus groups with parents in Utqiagvik, Dillingham, Anchorage, and Wasilla. We specifically chose Dillingham and Utqiagvik as focus group locations because those communities report a higher rate of consuming sugary drinks. About 10 parents attended each focus group, and the parents who attended said they regularly served their children sugary drinks. When I started talking about our project, I mentioned that Play Every Day's role in the Healthy Drinks for Healthy Kids project was to create educational materials for the public and for dental providers. I'm going to start by focusing on the public education materials. During our focus groups with parents, we tested a number of possible concepts and scripts. We chose to film 2 concepts that were considered among the most meaningful and motivational by these parents in the focus groups. This first PSA focuses on tooth decay. I'd like to point out that our new partner this year is the Alaska Dental Society, and we include their logo on our educational materials.
It's just one sugary drink for your child. That can't be so bad, right? But week after week, year after year, the effects of all that sugar add up. Sugary drinks can lead to type 2 diabetes. They can destroy your children's teeth, turning their mouth from this to this. Cut out those sugary drinks. Serve water or low-fat milk. Get the facts about sugary drinks at playeveryday.alaska.gov.
The second PSA focuses on the idea that parents are already switching out what they serve their children during meals. They're removing the sugary cereals at breakfast and the sweet options at lunch. Removing sugary drinks is one more way to protect their children's health. We are running both of these PSAs on TV statewide right now, as well as sharing them online.
You've already switched out that sugary cereal and started her day with a healthier breakfast. You've stopped packing that granola bar in his lunchbox. But you'd be doing more to protect your children's health if you also stopped serving them sugary drinks. Just one sugary drink often has more added sugar than your child should have in one day. Cut out those added sugars. For a healthy future for your family, choose water or low-fat milk.
We also created 3 short animated videos focused on how much sugar is hiding in sodas, powdered drinks, and vitamin drinks, and how that added sugar can lead to serious health problems. You can find all of those videos online at the link provided. When we make videos, we often make print materials that match. Here is the poster series we printed this year. These were sent to hundreds of elementary schools, public health centers, WIC clinics, SNAP partners, and dental and healthcare providers. These focus on drinking water instead of sugary drinks for the best health. For several years, we've been printing this very simple poster that promotes drinking water and filling up your water bottle at water fountains or water bottle filling stations. We also print matching rack cards. Rack cards are handouts for teachers, dental or medical providers, health fair staff, or anyone who'd like to share educational information about sugary drinks and water. They are about the size of a brochure, but they only have 2 sides, a front and a back. All of these materials were made for public education. We are hoping to reach as many Alaska families by sharing the messages on TV, online, and through print materials. Our Healthy Drinks project, however, is also focused on making materials that can be delivered much more locally in a dental clinic. One of our biggest efforts for this project was designing a sugary drink clinical intervention for dental providers to give to Alaska families when they come in for a dental visit. This guide is called When Sugar is Not So Sweet. This intervention is based on the successful 5 A's tobacco intervention. In tobacco prevention and cessation, the 5 A's stand for critical steps in the intervention. Providers ask about tobacco use, advise patients about the health risks associated with use, and assist patients to come up with a plan to quit use. When the 5 A's are systematically integrated into a clinical practice, patient quit attempts can increase and more patients can successfully quit tobacco. In our work, we took the tobacco example and turned it into a sugary drink intervention. The intervention is meant to be brief, about 5 to 10 minutes, and it includes colorful images, simple questions and phrases, and patient interaction to help families come up with a plan to reduce sugary drink consumption. The interventions were printed in vinyl binders with pages made of special material that can be wiped and sanitized in a clinical setting. We attended 2 dental conferences this month and handed out many of these printed interventions to dentists and hygienists. We have planned trainings for this intervention in Bethel and Ukiagvik and possibly other communities this fiscal year. All of our materials are featured on our campaign website, which is playeveryday.alaska.gov. We have a rotating photo banner at the top that helps you see the main part of our campaign and click to the sections you want to visit. This rotating photo banner shows you the drink this, not that image. Clicking this photo sends you to a new website we created this year. This new website provides education about the importance of cutting back on sugary drinks to improve health. There are links to other web pages that can help families understand what drinks contain added sugar, how those drinks can harm health, ways to make water and milk easier options at home, and more. All of the educational resources we've made for sugary drinks and water consumption can be found on this website. This includes all of our posters, rack cards, TV PSAs, videos, dental provider interventions, and school lesson plans. I have focused this talk on our sugary drinks materials, but we have a matching website that includes all of our physical activity PSAs and matching print materials. The website for this page is at the bottom of the slide. Play Every Day engages in 2 types of social media, Facebook and YouTube. The campaign has almost 13,000 fans on its Facebook page, which provides a large audience to share public education posts and attachments related to child health, obesity prevention, physical activity, and choosing healthy drinks. Our state website is also unique in that it hosts a blog. For the past few years, Play Every Day has been posting about 2 new blogs each month that focus mainly on Alaska efforts to address childhood obesity, physical activity, and sugary drinks. We like to find examples of strategies that are working in Alaska communities, write about them, and share them as ideas for others. You can sign up for a free service to receive updates about the Play Everyday website and its new blogs by going to the bottom of the campaign website, again, playeveryday.alaska.gov, and clicking on the green envelope about announcements. You can type in your email address. Every time the page is updated, we send this listserv a brief announcement letting people know what's been added. This is just one example blog that we recently published about our Healthy Drinks for Healthy Kids project. It explains the project and what resources you can find and share with others. We can all continue to work together to share the message about the importance of preventing and reducing childhood obesity, increasing physical activity, and decreasing consumption of sugary drinks. We can work with partners to support families in getting 60 minutes of daily physical activity and reducing the consumption of sugary drinks, hang posters, hand out rack cards and other educational materials, play the PSAs and videos in clinics, in schools, and other settings, use the brief intervention in dental offices, use the lesson plans in elementary schools, model the healthy habit of drinking water, and share the Play Everyday website, Facebook page, and YouTube channel as resources. That is the end of my presentation today, and I'm happy to open it up for questions. This is just a simple page again to explain how to ask questions either out loud or by typing them in. As I'm waiting to see if any questions come in, just a reminder that we will be putting both the PowerPoint and the webinar on our webinar series webpage within the next couple of weeks so that anybody who would like to see it again can do so, or they can share it as a resource with others. The question that has come in is, are reduced cost water filters available in communities that have bad tasting water? Dan, that's a really great question. I can't answer that at the moment, but I can say that we continue as a campaign to work with our partner organizations, including ANTHC, to look at water issues that are being raised in some of these communities. Question has just come in about what has been the reception we've received from the dental health providers to partnering with you on this campaign. I would say we've had great support from our dental providers. We have met with them multiple times over the course of this grant, both in person at advisory panel meetings and over the phone and in distance ways. We've also, as I mentioned, just visited 2 local conferences. We attended the Alaska Dental Chiefs at ANTHC a couple weeks ago, and then a few days later attended a statewide dental hygienist conference. And we handed out about more than 100 of these dental provider intervention tools and presented how we did sort of a show about how to use it in the setting, and it was received very well. We're going to be having some sort of more one-on-one sessions with our obesity prevention team, again traveling to some sites, Bethel and Utqiagvik, to show how this tool can be used, and then make sure it reaches to many providers in other parts of our state. Again, as questions, I wait for questions to come in. You're welcome to look at Play Every Day more closely, again, at playeveryday.alaska.gov. You can also reach out to me either by email. The general email, playeveryday@alaska.gov, comes to me. You can also reach me at my contact information about this, and I can happily send you all the materials that we have. We almost always have print materials in stock, and I can send you 11 by 17 posters and the rack cards that we have both on physical activity and on sugary drinks and water consumption. Right, I think that is all the questions we're getting in here right now. We will be sure to post this online soon, and we thank you for your time this afternoon. Our next webinar will be in January, so please stay tuned for announcements about that. Thank you.